Okay, now I shall show you an interesting suturing technique which is called the buried suturing technique. As the name suggests, the sutures will be buried under the skin. So among the type of sutures is called a subcuticular suture technique. So this technique, when you open the wound for the patients to see, they will be surprised that they don't see any sutures around because all the sutures are being buried. And this is usually used for absorbable type of sutures. Okay, first and foremost, you need, unlike previously, we take the wound from outside, now we're going to go from inside. You see? It usually starts in one end of a wound, like that. Okay. Okay. Again, inside out. As you see, it's buried, so we have actually to dig inside to see it. All right. Once that's done, we will tie from the inside. Okay. Instead of cutting both the sutures, now we're going to cut only one end. Okay. If you can see, it's starting to get buried. Then we will take in a superficial surface, suture that way, like a zigzag pattern. Okay, I'll just do a few so that you will see how it goes. And maybe one more after this. And then I will show you how do you close this wound. Once you've done that way, okay, you can see the wound coming together and you can't see the sutures. So how do you end this? You end this, okay, let me finish up to the end then. Spend a bit more time on this. Okay, we're almost to the end. Okay, towards the end, we'll take one buried suture down and out that way. Create the loop there. Okay, again, instrument tie. Hold the suture, put it in, another one, put it in, another one, put it in. Cut the end, and this is how we end it. We take this end and we bury the whole thing under, and as we pull it out, the whole thing closes up. That is the buried suture technique. Now you can compare all three.